A chronic ear infection is a very common form of illness in young children. In fact, it's the most frequent illness that causes a child to go see their doctor. 3 out of 4 children will have a middle ear infection by the age of 3. These infections come with ear pain and fever, so children are often irritable or listless, and they may lose their appetite or have trouble sleeping.
Milo's had ear infections for a long time. He's had them since he was probably 6 months, 7 months old, I think.
The most common cause is just acute infection of the middle ear, that otitis media, and it usually happens after they have a cold. Their nose gets stopped up. Sometimes the germs that are in your sinuses can actually get flushed back up into the ear, and then they take root and get an infection.
A middle ear infection is serious because it can cause possible hearing loss, so ongoing infections need to be monitored. Children with certain risk factors may get more frequent ear infections, and some of the causes may surprise parents.
Taking a bottle to bed is believed to be associated with an increased risk of ear infections. Children that have allergies are more likely to have ear infections. If their parents smoke, they're more likely to have ear infections. Acid reflux can get up into the throat and cause inflammation. Children who have cleft palates can have problems with their ears. Children that have immune problems might be more likely to have that.
Ear infections are initially treated with basic medication for pain and possibly antibiotics, using a cautious approach so that antibiotics aren't overused. A warm heating pad and eardrops often help. In some cases, it becomes necessary to perform a surgical procedure to remove fluid from the eardrum and insert a small tube in the middle ear to maintain drainage.
The tubes are what really helped him the most, I think, with it all.
You can learn more about ear infections from your child's doctor, who may refer your child to a specialist for surgical treatment. For Kids Health Check, I'm Betsy Moore.